Hello everyone, welcome back. Let's continue with our chapter front of the leg. In the previous video, I have completed the muscles and the extensor retinaculum. In this video, I'll be covering the anterior tibial artery and the deep peroneal nerve. Now, talking about the anterior tibial artery and the deep peroneal nerve, this diagram is very much important to write the relations of both the anterior tibial artery and the deep peroneal nerve, whereas this diagram will help you to understand the course of the anterior tibial artery. Now, जैसे हमने पहले भी वीडियोस में देखा है कि first we understand the course and the relations through the diagram and then we move towards the theory part. So doing the same, in the anterior tibial artery, you have to make sure that as usual, you will write the beginning course and the termination, the relations and the branches of the artery, and if any clinical if कोई होगा तो. Talking about the anterior tibial artery is the main artery of the anterior compartment of the leg. It is a terminal branch of the popliteal artery. हमने देखा था जो popliteal artery है at the lower border of the popliteus it divides, so it gives branches. So anterior tibial artery is one of the terminal branch of the popliteal artery which begins at the lower border of the popliteus. Popliteus हमें पता है back of the leg क्या होता है, so it begins at the back of the leg at the lower border of the popliteus. फिर वहां से it enters the anterior compartment by piercing the interosseous membrane by passing close to the fibula and opposite to the tibial tuberosity. See, now this one diagram will help you to write the entire course of the artery from the back of the leg up to its entrance into the front of the leg. In front of the leg, you don't have anything much. In the front of the leg, the artery descends downwards in between the two malleoli. Now, after the two malleoli, so this is our lateral malleoli and this is the medial malleoli which is formed by the tibia. There is a lateral one which is formed by the fibula. After the two malleoli, it is named as the dorsalis pedis artery. So this is the entire course of the anterior tibial artery from the popliteal artery up to the dorsalis pedis artery. Now talking about the relations, as I told you earlier that this diagram will help you to write the relations. Now see, in this diagram you can see the anterior tibial artery can be divided into the three parts, such as the upper 1/3 part, the middle 1/3 part, and the lower 1/3 part. Now, talking about the upper 1/3 part, if we see in the upper 1/3, the artery lies between the tibialis anterior and the extensor digitorum longus. In between the tibialis anterior and the extensor digitorum longus, whereas in the middle 1/3 part it lies between the tibialis anterior and the extensor hallucis longus. The artery lies between the tibialis anterior and the extensor hallucis longus, whereas in the lower 1/3 part it lies between the extensor digitorum longus and the extensor hallucis longus. So you can very well see that this is a tendon of our extensor hallucis longus, this is of the extensor digitorum longus. The artery lies between the extensor hallucis longus and the extensor digitorum longus. So this becomes our relations of the anterior tibial artery. Okay, now coming on to the theory part, a quick review to the theory. Anterior tibial artery, small branch of the popliteal artery, begins at the back of the leg at the lower border of the popliteus, enters anterior compartment by passing close to the fibula. You can write opposite to the tibial tuberosity. In the anterior compartment, runs downwards in the point between the two malleoli, becomes the dorsalis pedis artery. So this is the line diagram where you can write the relations of the anterior tibial artery. Upper 1/3 tibialis anterior and the extensor digitorum longus, whereas middle 1/3 tibialis anterior and the extensor hallucis longus, whereas the lower 1/3 extensor hallucis longus and the extensor digitorum longus. Branches, if we see, so anterior and the posterior tibial recurrent artery, which takes place in the anastomosis around the knee joint. Okay, the anterior medial malleolar, and the anterior lateral malleolar branches take part in anastomosis around the ankle joint, whereas muscular branches to the adjacent muscle. So branches, if we see, so tibial recurrent, the medial and the lateral malleolar, and the muscular branches to the adjacent muscles. So this was entirely about the anterior tibial artery. Now, continuing the video, we will be completing the deep peroneal nerve also. Talking about the deep peroneal nerve is the nerve of the anterior compartment of leg. If I use the same diagram only of the relations wala, here you can see the deep peroneal nerve is the branch of the one of the two terminal branches of the common peroneal nerve. Here we can see that it pierces the anterior intermuscular septum. Okay, pierces the anterior intermuscular septum. If you talk about the root value, क्योंकि nerve है तो उसका root value जानना बहुत important है. It's the ventral rami of the L4, L5, ventral rami of the L4 से लेकर S1 तक. Okay, L4, L5, S1 and S2. Sorry, S2 तक. L4, L5, S1 and S2. Okay, ventral primary rami of the L4 से S2 तक. Talking about the course and the termination, the deep peroneal nerve begins on the lateral side of the neck of the fibula. It enters the anterior compartment. It lies on the lateral side of the neck of the fibula, on the lateral side. It enters the anterior compartment by piercing the anterior intermuscular septum. Now here you can see it then pierces our extensor digitorum longus muscle, and lies next to the anterior tibial artery. Okay, and lies next to the anterior tibial artery. So the nerve ends, if we see, the nerve ends at the dorsum of the foot by dividing into the lateral and the medial terminal branches. Okay, here if we see, it gives the lateral and the medial terminal branches. We'll talk about it in the theory wala part. Talking about the branches ही है इसके बाद. तो अगर हम कोर्स एक बार वापस रिवाइज करेंगे तो continuation of the common peroneal nerve pierces the anterior intermuscular septum, then the extensor digitorum longus, and then lies next to the anterior tibial artery. Okay, so deep peroneal nerve of the anterior compartment, branch of the common peroneal nerve, root value L4, L5, S1, S2, begins at the lateral side of the neck of the fibula, enters anterior compartment by piercing the anterior intermuscular septum and extensor digitorum longus, and lies next to the tibial artery. Nerve ends close to the dorsum of the foot by dividing into the lateral and the medial terminal branches. Okay, talking about the lateral terminal branch, it turns laterally and ends in the pseudoganglion deep to the extensor digitorum brevis. अगर हम अपने lateral branch की बात करेंगे, इस डायग्राम में नहीं है. The lateral branch जो है that ends in the extensor digitorum brevis in the pseudoganglion, whereas the medial terminal branch supplies the first interdigital cleft. Medial terminal branch ये देखो, this is our first interdigital cleft. So medial branch supplies it. Muscular branches supplies the tibialis anterior, extensor digitorum longus, extensor hallucis longus, extensor digitorum brevis, and the peroneus tertius. That is the muscles of our anterior compartment of leg. It has cutaneous branches and the articular branches to the ankle joint, tarsal joints, temporometatarsal joints, and the metatarsophalangeal joints. Foot drop is a very important MCQ based upon the deep peroneal nerve. It is the paralysis of the muscles of the anterior compartment of leg. Now if you see the deep peroneal nerve, see here it lies lateral to the fibula, then here it pierces the intermuscular septum and lies next to the anterior tibial artery. If you talk about the foot drop, since the medial terminal branch supplies the first interdigital cleft, if any injury, it will cross. See, common peroneal nerve, trauma, neuritis, leprosy will cause damage to the deep peroneal nerve, which will result in the paralysis of the muscles of the anterior compartment of the leg. And we know that the muscles are generally the dorsiflexus. So there will be a foot drop, and which will result into the, there will be foot drop. So loss of dorsiflexion, and secondly, there will be a sensory loss at the first interdigital cleft. There will be loss of dorsiflexion. This point you have to include while writing the foot drop, loss of dorsiflexion. Okay, so this is about the anterior tibial artery and the deep peroneal nerve. I hope that this video is very clear. If any doubts, please feel free to ask me. You can directly DM me on Instagram, या फिर you can put your doubts in the comment section. I will surely reply to it. Thank you.